Hello, I'm urologist Omer Erdamakaya. Today we will have a short video presentation on what is late ejaculation and what are the most common causes of it. Late ejaculation is the continuation of the intercourse for more than an hour or two and the inability to ejaculate or to ejaculate with a great difficulty. We call this situation late ejaculation, which is a serious sexual dysfunction, and although it is much less common than premature ejaculation, it actually creates a serious problem for the patients. It creates a problem both for the patient and his partner. It may cause the partner to have vaginal dryness and vaginal wounds. And the couple may not want to have another intercourse, because it is very tiring for the couple as it takes too long. Apart from that, one of the most common reasons of it is the use of psychiatric drugs, use of antidepressants. This is one of the reasons of late ejaculation, so that we use antidepressants for premature ejaculation treatments. Because it makes the intercourse really longer. 5 years ago, I had a patient. He said, "I used to ejaculate 5 times a night but now I can only do it once and it takes too long to ejaculate and makes me tired." After we dug his story, we saw that he had been on antidepressants for longer than 6 months. I have a video about it too, about use of antidepressants. You can see which kind of antidepressants causes this. Afterwards, the second most common reason is traumatic masturbation syndrome. It's that the patient gets used to have masturbation in a dry and hard way and he can't feel the pressure of the vagina when he is in during the sexual intercourse. It's the situation where he feels as if his penis goes forth and back in the emptiness, and since he can't ejaculate, he takes it out to masturbate to ejaculate. And these patients may claim that vagina of their partners are too wide or wider than usual. They may claim that they don't feel it. These patients have traumatic masturbation syndrome. Its treatment is easy. When the patient quits masturbating and pornography, he feels hungry for the pleasure after a while and he recovers himself. He recovers in a short period of time. Another common reason is the problem between the couple. If there are anger, fury, hate, enmity, revenge between the couple and these emotions are more than the love and respect, the male partner may feel like a crime or penance to ejaculate and have pleasure from the female. He might not be able to ejaculate or might ejaculate with difficulty. This is about subconscious, the patient may not even notice it. Or if the patient has another problem. For example, if he has problems about his ex-partner or his children, the late ejaculation may depend on this. This is a reason even if not very common. Apart from that, there are men who prefer Taoist sex or some East sex like Kama Sutra. These men may have sex very slowly for hours. This is about the preference, depending on his will. Apart from that, like I said, late ejaculation is one of the very important sexual dysfunctions. But the patients may confuse late ejaculation with dry ejaculation. In dry ejaculation, the patient has an orgasm, but in late ejaculation, the patient does not. Again, the dry ejaculation depends on the drug use. Especially patients who use prostate drugs such as alpha blockers may have the dry ejaculation. Or again, in people who have not completed puberty may have the dry ejaculation while masturbating. Dry ejaculation doesn't mean late ejaculation. Dry ejaculation is also one of sexual dysfunctions. Even, some patients may continue the sex thinking that he didn't ejaculate but actually he had a dry ejaculation. This also makes the intercourse too long. There is also an easy treatment for those patients. As I said, the dry ejaculation is different from the late ejaculations. Thank you for listening. Best regards.